Big story of the hour, rescuers are continuing to search for survivors of this week's devastating earthquakes in Venezuela as the clock ticks down on the golden window to save those trapped in the rubble. There are at least 920 people that have been killed in the earthquake so far. Hospitals are struggling to treat the injured amidst decades of neglect in Venezuela's healthcare system. Some residents are calling for civilian volunteers to help clear debris, frustrated by the slow pace of the rescue operations. International search and rescue teams from at least 17 countries are being scrambled to Venezuela to help look for survivors of the devastating twin earthquakes. India has launched Operation Amistad to aid earthquake-hit Venezuela and send ambulances and medical aid to the country. Dr. Uma Ananda joining me on the telecast. Dr. Uma Ananda, let's hear it from you with regards to the very difficult situation that the people of Venezuela are going through at this point of time. It has been about 48 hours. How difficult is it going to be for the relief and rescue teams to dig out people alive from the debris?
Well, good morning and good evening in India. Well, it's devastating to see the news. I had the opportunity myself to go down and try to help as a volunteer in La Guaira yesterday morning. And the situation is, as you just described, that there is not. We're already touching the window of 72 hours this afternoon, and the help is striking its minimum. We are expecting more international aid arriving between yesterday that already has started to arrive, and today afternoon as the time is passing, and it's very stressful for all of us to see that only volunteers are present in campus.
Dr. Jagnino Gonzalez, also tell me more about the countries that have come together to help Venezuela in its time of distress. India has sent out medical supplies, ambulances. There are countries including France and Spain, United Kingdom, United States of America. They've all come out and chipped in to help Venezuela and the people of Venezuela. Do you think that's enough?
No, we actually need more machinery. Also, we need the professionals that are prepared for that. We also have seen Swiss and other countries in the Americas helping Colombia and El Salvador, Dominican Republic, and as you well mentioned, India and other countries, USA, United Kingdom. Also, Macron was referring to the country as well, and but the help is slow to arrive, and the emergency is huge. We're talking about more than 100 buildings down, like in a specific form that they call it. The scientifics call it as pancake form. They're coming down to earth one after the other, one floor after the other, and the emergency is actually being led by basically the community, the organized community, and the volunteers and the family. At the moment, it's what I can tell you from my own experience in my eyes. More than all the news that are public.
The official count of the number of people that have died, unfortunately, has risen to 920. Do you think this number could increase exponentially, keeping in mind there are many people who are feared buried under the debris?
There are. I think this number is very small. There's still people. We can also sense smell of death, unfortunately, around the areas, and 920 is not the real number. And as the time passes, the number will increase, of course. But we need the help to bury all those bodies and give honor to them.
How's the healthcare system? Does Venezuela at this point of time have a concrete stable healthcare system that is going to be adequate to provide relief, to provide the injured the much needed medical aid at this time?
Yeah, well, we have hospitals, and unfortunately, there are NGOs helping, and there are movements also, not only in regular hospitals but in clinics, helping with centros of acopio, handing in all the materials and all what we want to give. But apparently, it's not enough. The last thing we heard in the last day is that the government has closed and the entrance of La Guaira. The La Guaira state is the state that has been hit more regarding to other states, and they're trying to organize who is allowed to come down and who's not, and that gives a little space of doubt, especially for the people who are already organized and family members and people want to help. But it's striking and really touching is to see how much solidarity there is, how much resilience between people. If we look carefully to the stories one by one, then you can see how much care there is from people who are spending hours waiting for the proper help, but also organizing with the bare minimum themselves and their hammers and
Dr. Regnino Gonzalez, thank you very much. She has joined us from Caracas. That has been